So basically, the patient or the person comes in and they have basically myself, an anesthesiologist, or some type of anesthesia personnel, along with a couple of nurses and or one nurse and a tech. And basically the patient is made to feel very comfortable. They come in, we kind of make sure we have the right patient, do the appropriateness of that, and then they're sedated. And then the first thing I do is basically just an exam of the outside part of their kind of rectal area, make sure I don't see anything abnormal. And then a scope that's basically the size of my forefinger is inserted under direct visualization. It's like a camera, and it's got a flexible tip, and my left hand is basically turning the tips. And we're basically going around, and we're dealing really with the colon. So you may hear large intestine, large bowel, colon. They're all really synonymous names. We're also looking at the rectum and looking at the anus. And some people will also look at the very end of the small intestine, which is called the distal ileum. That's really what you're examining. And what are we examining for? Polyps, inflammation, something worse such as a cancer, or some sort of a disease such as Crohn's or colitis. Those are the more common things we find. What can we do if we find something? If it's a polyp, we're generally trying to remove it, and there's different techniques of removal that have also improved over time. So no longer does a regular polyp or a polyp that we used to have to do surgery, we have techniques to remove those, and they can often be done at the same time or in a stepwise fashion. The process itself can take anywhere from 10 minutes to a half hour. There's going to be a certain point where you're pushing the limits of how much insufflation or how much air you're pumping into somebody, where the risk becomes too high. But the most important part is getting all the way through and the slow withdrawal or removal of the tube and the air as you're going back looking for inflammation, polyps, something worse such as a cancer. If biopsies need to be taken, they're taking it at the same time. And then basically the tube is removed. People are taken to recovery. 20, 25 minutes later, a family member is there to take them home, or some sort of other person they've made arrangements for a ride. They enjoy the rest of the day, and they do what they need to do the next day.